Breast cancer is the most common cancer among women in the United States. Other than skin cancer, it's a disease that impacts families from every background.
Tonight, we are teaming up with Susan G. Komen, North Florida, to help raise money for patients and survivors. Mary is joining us now from our phone bank where you can donate tonight. Mary?
Yeah, Jen and Rob, we hope to make these phones ring. Volunteers are here from our Komen Phone Bank. They're here to take your calls, your questions, and your contributions until 7 tonight, and they'll help you sign up for the Race for the Cure as well. Joining me now is Jeff Mathews, Chief Operating Officer of Volunteers in Medicine. Thanks so much for being here with us. And Volunteers in Medicine is one of Komen's grantee organizations. And Dr. Leo Alonso, a physician who volunteers with Volunteers in Medicine. Thanks so much for being here, both of you. I think, first of all, let's start with you, Jeff. At 5, we saw the story of an Orange Park woman who waited so long to get treated. She knew she had breast cancer. She knew something was wrong, but she waited months to get treated because she didn't have any insurance. Do you see that type of thing happening in Volunteers in Medicine?
We do. We are a clinic. If you're not familiar with us, we're a clinic for the working uninsured.
Right.
I don't know her particular situation, but I know that in the metropolitan Jacksonville area, there's about 1.3 million people, and about 120,000 of those people are uninsured. And this is what we run into all the time. And of course, if you're uninsured, you're less likely to access care, you're less likely to have education and prevention, and that's what happens, and that's why we're there, is to prevent that from happening.
Man, that can be heartbreaking. I mean, Dr. Alonso, you must see heartbreaking cases all the time then as you volunteer there.
Yes.
And you worry. I mean, these people come in here too late sometimes?
Sometimes. It's nice to know that there's a place like the clinic that they have to go. Often they come to the emergency room, which is my other job, and that's where I see them. But the clinic offers options that are all free to them: ultrasounds, mammograms, and Mayo Hospital works with us for chemo and radiation therapy.
Komen here, huge word, right?
Yes.
Where would we be without Komen and the money that's coming in here to help Komen in this race?
It's a community service that I think only as a patient at the recipient end can you fully appreciate what they do.
And what types of things are we seeing? I mean, the money that comes in here, 75% of it stays here in North Florida. When you call in and make a contribution, what are we doing?
Well, I'll give you some statistics that I happen to have here. We've worked with Komen since the end of 2004, and in that time, they've given us just shy of $320,000. And what we do with that money is we provide mammograms and ultrasounds. We provided over 2,000 screening mammograms, over 570 diagnostic mammograms, 502 ultrasounds. And again, as Dr. Alonso said, we send our folks to Mayo Clinic if it's suspected that they have breast cancer, and we've actually diagnosed 27 cancers, and all of those have been treated by Mayo for free.
These are people who probably wouldn't have gotten any help without you.
That's true.
Correct?
Without Komen and us.
Without Komen and Volunteers in Medicine.
And you know, it's not always the diagnosis of cancer. There's a lot of women that come in with a fear. They feel something, they think they have cancer, and we can rule it out with the testing at no cost to them, and that's a big thing too.
That's huge, and we want women to know, be aware,
Absolutely.
make sure that you are, if you have any questions, that you're getting that checked out. Dr. Alonso, thanks so much for being here. Jeff Mathews, thank you so much. And we hope to take your call. Any amount that you can donate can help to help Susan G. Komen in this fight against a potential killer. We're here until 7 tonight. Call 1-800-366-9598 or 348-6022.
Tracking inconvenient weather.